see. Which one's your favorite fish?
Look.
What's that? Ooh.
Mama, what's that?
It's a little shell. Where are the turtles? Right there, yeah. How many turtles do you see?
1, 2, 3, 4, 5.
5 turtles.
Hey, that
There's
was
more than 5.
Mommy, that was a 20.
Are you sleeping?
Yeah.
Hi, and welcome to the Dr. Mom Show. It's Dr. D, mom of 3. Hope everybody has had a good week. For anybody who's been affected by Hurricane Michael or even the rains, winds, tropical storm that has been associated with it, I hope everybody's doing well, and I pray that everybody is safe and there hasn't been too much damage in your area. And we continue to pray for those who were severely affected by Hurricane Michael. Well, today I'm going to talk about ADHD and ADD. That's attention deficit disorder or attention deficit hyperactivity disorder. And this month is ADHD Awareness Month. So again, I just wanted to give you some information and let this be a resource for you. Remember that the Dr. Mom Show is just an informational resource for you. It does not take the place of the advice or recommendations of your provider or your child's provider. It is just another source for you to get some more medical information from. I hope you enjoyed that clip of the Tripsies. They are hilarious. Don't you think so? And they're super cute. They're getting so big. Well, let's start off with, again, ADHD, ADD. And again, the biggest difference is just that ADHD includes issues with attention and hyperactivity and impulsivity, whereas ADD just has to do with attention issues by itself, not with hyperactivity. There will be a little crossover because, of course, kids can have ADHD and adults can have ADHD or ADD. So you'll kind of see me, or hear me, I should say, flip back and forth between adults and kids, even though overall the majority of things are about the same. So as far as the diagnosis itself, the diagnosis is usually made by a physician. It can also sometimes be made by a psychologist. A lot of times for the kids side, kids come in because teachers have concerns about them. Of course, with adults, they usually come in because they either can't focus or get their work done at school or at their job. So when we diagnose ADD or HDD, usually we use a lot of questions because we have to take a good history. There are some scales that we use, and there are multiple scales that can be used, but I'll tell you a little bit about the ones that I use. So for my kids, I use the Vanderbilt. So if you hear your child's pediatrician talk about a Vanderbilt scale, the reason I like it is because that's what I trained with, and it also helps because it asks questions about other things like depression, anxiety, oppositional defiant disorder, just some other things, because a lot of times when kids have symptoms that could be considered ADHD or ADD, a lot of times there may be some other things going on, such as depression or anxiety, because of course when you have a smaller child who isn't able to tell you exactly what's happening, sometimes it's a little trickier. So when we talk about kids, usually their teachers who spend the most time with them will get a scale, and then the parents will also get a scale. Those scales are good for kids who are about 7 and older. For kids who are younger, about like 4 or 5, there's one called the Connor scale. The Vanderbilt really hasn't been shown to be as specific or sensitive to these symptoms with younger kids. And most of the times when these kids are younger too, they should have a psychological or a psychiatric eval or a developmental pediatrician. That's a pediatrician who has done an additional 3 years of training in behavioral pediatric medicine. So it's always nice to get those specialists involved when those kids are younger. And that also, again, just has to do, as I mentioned before, with the fact that they're younger and it's just harder to get that good history of how they're truly feeling. Um, as far as adults, there's another Connor scale for adults, and that we can use, and again, it asks questions, also incorporates questions about anxiety, depression. And again, these scales help us because there's a score. Normally, overall, there has to be about 6 or more symptoms for either hyperactivity or impulsivity. And then, of course, 6 or more for inattentiveness. So that's what we look at with these scales. And of course, what's nice, we also use these scales because if we start any treatment modality, is it helps us to follow up, because we would give the scales to the teachers or parents again, and we watch these scores and see if those scores are coming down. Again, I always reiterate that you don't necessarily have to have the score at 0. It's just that you want to make sure that the patient is functioning and doing better at school, doing better at home, doing better at work, being able to focus, getting their tasks done. So again, the score doesn't necessarily have to be 0 in order to correlate with the medicine working. Really, you just want to see the scores coming down on those scales. As you've heard me mention multiple times already in this talk, is that ADD and ADHD have been found to be associated with other psychological issues such as depression, anxiety, obsessive compulsive disorder, sleep issues, so things like insomnia, tics. So those are all things that you want to assess these patients for. The nice thing too is that even though we find this overlap, a lot of times if we figure out, for example, if we have a patient who we have diagnosed depression in addition to ADHD, a lot of times if we treat the depression, the symptoms of the ADHD may decrease. So that's what's nice. That's why it's really important that these patients get treated appropriately. And of course, I always tell my patients, even though some, for example, if a teacher says, hey, I feel your kid has ADHD, I always reiterate to parents that, we don't automatically diagnose them with that just because the teacher says that. We go through the whole assessment process because, again, we want to make sure there aren't any other underlying issues, again, just such as depression or anxiety. As far as treatment of ADD and ADHD, you can have therapy, so like a psychiatrist, psychologist, and or medication. So as far as the therapy, usually if the children are younger, so again like 4 or 5, really it's recommended for therapy to see if they do better with that. Once the children are about 6, 7 and above, we do recommend, of course, the best thing that has been found as far as treatment in the research has been dual therapy with counseling and medication. However, at that point, medication would be the better part for those patients, because normally at that age it starts affecting their academic performance. So patients will come in with like D's and F's because they're not able to focus, or they're blurting out in school, or getting in trouble in school for talking, not raising their hand, skipping the line, things like that. As far as the medications themselves, most of these medicines are stimulants, and there is, I should say, a non-stimulant medicine also. At this point, what we do is we usually ask, as far as family history, what has gone on. So just for your information again, if there is a parent or sibling who has a diagnosis of ADD or ADHD, there is an increased risk for another sibling or for a child to have it. Of course, we also ask about what medicine has been used and what has worked, and that has a higher chance of helping. There are some places that can do a genetic testing, like a DNA test through a mouth swab or a saliva swab, and that helps with these medicines to see which one is more sensitive based off of your DNA. However, those tests can be a little costly. So if a patient is unable to do that, we do go ahead and start medicine and go from there and titrate the dose if we need to, or if they're having any side effects, we do change the medicine. Usually these patients do really well once we find a therapy that helps. Just realize that if you start on medicine, that doesn't necessarily mean that you have to be on medicine for the rest of your life. I have seen some people who have come off medicine, and as they get older, they do better at regrouping, refocusing, telling themselves that, okay, I can't have multiple distractions. They know that when it's time to study or to get a task done from their job, they need to be in a room by themselves, not have the television on, not have other people in the room. So environmental things that they can change. Well, I hope you enjoyed this informational program about ADHD and ADD. Again, this month, October, is ADHD Awareness Month. If you have a child who has it, or if you yourself has it, um, definitely I hope you're getting taken care of, and at least now you know some things to look out for, and kind of what's done for it. All right, well, I hope you have a great day. Don't forget to wash your hands, kiss your kids, hug your family, and say your prayers good night, and love everybody around you. All right, we'll see you later. Bye-bye.